Hey everybody, it's Facial Plastics Friday. It's Dr. Brace here, and by request, in response to our story this week, I'm going to talk about the preoperative experience here at Guelph Facial Plastics and preoperative planning for a rhinoplasty. So I just left Kate's desk, dropped off some paperwork, and I'm just heading down the hallway to my office here. And so the first thing that happens if someone's interested in a rhinoplasty is that they reach out by email, by social media messaging, by phone call. And the first person you'll talk to is Brittany. Brittany is our patient care coordinator. She's very knowledgeable in what she does, and she spends her days on the phone talking to patients who are interested in surgery. And so whether it be a facelift, a neck lift, a rhinoplasty, otoplasty, whatever it is, Brittany will walk patients through the process of what surgery looks like, what the costs are in terms of ranges depending on what's going to happen, what to expect in recovery, so that booking it will make sense and there's no surprises. So say hi, Brittany.
Hi.
After a discussion with Brittany, if somebody's still interested in surgery, and then that's when the consultation happens, and we will meet pre-COVID times here in my office. Now we're doing virtual consults until the stay-at-home order is lifted. But if somebody has a virtual consult and wants to book surgery in the near future, we'll definitely see you here in office, do the appropriate photography, and confirm the plan before we do surgery. And so today I'm going to be talking about rhinoplasty. On the day of a consult for a rhinoplasty, I'll examine your nose, make sure that your septum is straight, make sure the area here, the nasal valve, isn't collapsing, that we don't need to put additional grafts in to support and improve your breathing. And then we'll take regular photography, and then we'll take 3D photography with the Vectra camera. Vectra is a camera system that allows me to manipulate the image of your nose so that we can have a discussion on exactly what you want it to look like. And then I use those Vectra pictures to guide me in the OR. So I print them out, I put them up in the OR, and then we make your nose look as close as possible to the imaging that we've done, that we've discussed together. In the operating room, I often have Nurse Jocelyn helping me. Say hi, Jocelyn.
Hi, everyone.
And Jocelyn is the face that you'll see after surgery to get the sutures out and the splint off that usually happens on day 6. I'm going to pass my phone over to Jocelyn so that she can film, and I'll take you through a Vectra imaging. All right, so after we take the Vectra photos, I'll pull them up on the screen. And so this is a 3D rendering of one of my patients' faces preoperatively. So we haven't done anything to her nose. And so I'll go over in a consult the things that I see. And we always start a rhinoplasty consult with general facial anatomy because everybody has facial asymmetries. Eyebrows may not be at the same height. There may be slight shape differences between the eyes. Cheeks may be of different levels. And those are all important considerations in a rhinoplasty because perfect symmetry is often what people think they want, but it's usually non-existent. Nobody's perfectly symmetric, and it's impossible to create. And so having that discussion on what your nose could look like realistically is what this program helps. And so after we address that, I often will go to the lateral or the profile view, and most women with a bump ask for me to take the bump off. And so we can do this with the camera system, with the imaging system, and just see what would your nose look like without a bump. And a lot of women, that's all they want. They want it to look nice and smooth. Sometimes people want more of a scooped look or a little bit more dramatic, and so we can have that discussion on how much of the dorsum do you want to come down. The more natural look would be relatively straight with a small little depression there. Then we look at how far the nose sticks out from the plane of the face, and we can talk about that. How far does the tip project? And so I can change the size of the nose with the Vectra. And in general, you want the nose to stick out about the same distance from the lip to the corner here. And so we might deproject this nose a little bit. And then we talk about rotation. And we can lift up the tip a bit to make it a little bit more feminine and refined. One of the things we'll often talk about in a rhinoplasty is the chin. And if the chin is slightly recessed and behind, it can make the face look a lot more symmetric if we put a chin implant in. And that's an additional thing that you can do at the time of a rhinoplasty, but to make the chin stick out a little bit more puts the face in more balance. If we switch back to the nose, often women want their tip to be more refined. If you look at from the base view, they want this to be a little sharper, and so we can make that happen with the imaging and give you a sense of what your nose would look like if we pulled the tip in made it stand up a bit more like that. And so at the end of the consult, we'll have the preoperative view and then the postoperative view of what you want your nose to look like. And it's often subtle changes, and people worry that they won't look like themselves if they do a rhinoplasty, but you can see here, she looks just like herself with the bump gone, the tip lifted a little bit, the nose set back, and the tip refined, so it gives you a good sense of what your nose will look like once all the swelling is down. So that's the procedure for pre-op consult for rhinoplasty. This is how we plan what's going to happen in the OR through a discussion with the imaging, and I'll talk probably next week on what happens post-operatively and what to expect in recovery. Have a great day, everyone.